Hi, Jason. Nice to
Hi.
meet you.
Nice to meet you.
I'm Megan. I'm going to be your nurse practitioner today, okay?
Okay.
Do you know what nurse practitioners do?
No.
They are like doctors. They take care of patients and they can prescribe medications if you need them, okay? So I'm just going to ask you a couple of questions. Can you tell me your name and date of birth?
Jason Andrew Renaud, 11/05/1985.
And can you tell me what's your address and phone number?
726 Linnea Way. Phone number is 608-774-1881.
Okay. Can you tell me what brought you here today?
I got a cough.
Okay. How long has the cough been going on?
About 2 weeks now.
2 weeks. Okay. Anything that helps the cough, or have you used anything, any medications over the counter?
Cough drops and Vicks.
Okay. Have you tried any herbal medications or anything like that?
No.
All right. What makes the cough better? Does the medications help?
Cough drops and NyQuil.
Okay. What makes the cough worse?
Breathing in cold air.
Okay. Can you tell me, as you said, it's been going on for 2 weeks. Anything else that you've noticed besides the cough? Any pain or anything like that?
Not that I've noticed, no.
No pain? Okay. Can you tell me some health history? So when was your last, have you been, had any like immunizations, like TB, anything like
No.
that, tetanus, MMR, just from when you were a child?
When I was in high school, yes.
Okay. Any flu shots or pneumonia vaccinations recently?
Since high school.
Okay. Have you had any like recent exposure to any like communicable diseases, or like gone out of the country at all that you're aware of?
Not that I know of, no.
Okay. Any allergies to medications, or
Not that I know of.
any allergies to the environment, like outside stuff?
Nope, I haven't had.
Okay. What's your past surgical history? Any surgeries that you've ever had?
Nope.
What's your past history? Have you ever broke anything?
Broke a leg maybe 20 years ago.
Which leg?
My left leg.
Okay. Did you get cast, or you didn't get surgery, obviously?
No, had a cast.
You had a cast. Okay. Anything else that you were aware of that you've ever been to the doctor for?
Spider bite
Okay. So where was the spider bite at?
on my hip.
Okay. And did they do anything for the spider bite?
No, just give me antibiotics for it.
Okay. How long ago was that?
14 years ago.
Okay. Have you ever been in any accidents or had the accidental injuries? We know about the leg, but anything else?
Not that I know of, no.
Okay. Are you on any medications right now?
Nope.
Do you take any over-the-counter medications that includes like aspirin and ibuprofen and?
Sometimes I take ibuprofen.
Okay. Do you take any supplements, like any over-the-counter supplements, like a multivitamin or
I
anything?
take vitamin C.
Some vitamin C. Okay. Do you use any like a special diet, like a gluten-free diet or anything like that?
No.
Or you go to get massages or anything?
No.
No. Okay. Acupuncture, not that
I
either.
get cracked. I go chiropractor once.
Okay. All right. What do you has you ever talked to your mom about your like when you were a baby, your prenatal history? That would be like where you were born. Do you know where you were born?
I was born in Beloit Memorial Hospital.
Okay. And did she ever talk about how that birth went? Was it kind of a complex?
No, I have no clue. Besides,
No clue.
I was twisted in her umbilical cord. Was twisted around my neck, so I was a rough baby to be
Okay.
born.
Yeah. Did she say anything about like that you were full term or premature?
Not that I know of.
Okay. So tell me a little bit about family history. Do you know about your family history for illnesses like your mom's side or your dad's side? Anything specific, like hypertension, diabetes?
Asthma runs in my mom's side.
Okay.
That's my dad's side. I know nothing about.
Okay. Any, do you know any cardiac history or any, the respiratory, you talked about asthma. Anything else? Allergies that you're aware of that run through the family?
Allergies runs on my mom's side. I think my uncle had diabetes.
Okay.
Other than that,
Any cancer?
oh, that I'm not sure of.
Okay. What about your sister? Do you have any siblings or sister? Does she have anything that you're aware of?
She's just allergies too.
Okay. So this is about your, like, kind of social history, so there's quite a few questions. Are you satisfied with your living arrangements and kind of your life satisfaction?
Couldn't be happier.
Okay, so tell me about where you live and your relationships.
Live in South Beloit. I'm married to my wife, Megan Renaud, for the last 3 years. We have dogs.
Okay. What do you do for work?
I do construction.
Okay.
For 14 years.
Okay. And how often do you work?
Every day, Saturday and Sunday.
How many hours?
40 hours a week.
And then is that pretty vigorous work? What are you exposed to with your work?
There could be bacteria because of cows. Poop.
You're around
Sometimes
cows.
we're around cows. Hay. Sometimes I'm not. I don't like being around hay a lot.
What else?
Sun exposure. We get a lot of sun.
Okay. Do you wear sunscreen?
That I do not wear sunscreen.
Okay, that's very important. Make sure you wear sunscreen. Anything else that you're exposed to that could be potentially dangerous for your health? Being high up in the air. Are you ever high up on the roof?
Yeah, but we're tied off, and it's all safety code. So.
Okay, and what about
Getting
insulation and things like that?
We have to wear masks and all that, but we do have to do around insulation. Yeah.
So you do follow those, some safety protocols,
yes.
So you don't get your health damaged. Are you able to afford medications and kind of your daily living? You're able to afford housing, all of that?
Yes.
Okay, so no issues affording anything?
No.
Okay. And did you go to high school?
Yeah, I got my diploma.
Okay, where'd you go?
Onondaga High School in Rockton.
Any more education besides high school?
No.
Okay. What do you use alcohol?
Yes.
How often?
Not weekends.
Okay. How on a week, say an average weekend, how much do you think you drink?
Maybe 6 beers.
Okay. What about smoking?
I never smoked a day in my life.
Okay. What about caffeine beverages, using energy drinks like Red Bull and things like that?
I used to have not Red Bull, the energy drink, but I don't drink those anymore.
Okay. What about, do you use any recreational drugs? That's do you smoke marijuana or use heroin, anything like that? No. Okay. What about, have you ever had issues with secondhand smoke?
Secondhand smoke, yes. I've had a concussion before too.
Okay. What about sleeping? Are you a good sleeper? How many hours do you get sleep?
Not the greatest sleeper now. I used to sleep good back then.
Okay.
I probably get a good 5 hours of sleep.
Okay, 5 hours. All right. Do you, in the middle of the night, do you kind of wake up and not get a good all-night sleep?
Yes.
Okay. Activities. How active are you? Seems
My
like your
job's
work
pretty active,
is pretty active. Do you do any activity besides that?
I used to, but not as much now. It's more golfing and playing horseshoes with my dad. Sometimes go boating and go wakeboard.
So that's still kind of being active. What's your typical day, and just a normal day in your life? What do you
work day or a weekend day?
Let's do a work day and then do a weekend day. What's your normal work day?
Get up about 6.
Okay.
Make my wife her lunch and coffee. She goes to work, and I go to work. Work 4 hours, and we take a 30-minute lunch, and then I work again. It's pretty active. Don't sit down much, and then I come home about 4:30. Let the dogs out. I used to go work out after work, but I don't do that anymore now. So I kind of just watch TV, play video games, or wait for my wife to get home from work and make dinner.
Okay. What about the weekends? What's your kind of...
Summertime, I have a goal, try to go golfing in the morning.
Mm-hmm.
And then afterwards, either we go boating or we'll go camping. More active, more in the summer.
Mm-hmm.
Wintertime, I don't know. Wintertime's kind of boring.
Yeah. So what's your daily food intake? Like, go throughout a day of what you normally would eat.
We'll eat more on weekends or weekends than weekdays.
Okay.
Morning, I don't really have a lunch. Depends if I'm hungry or not. If I do, it'd be a sandwich at the gas station. And then lunch is usually whatever we had for dinner before, or either I'll make a sandwich and have some chips and that. Don't eat too much till dinner time comes. Sometimes I'll come home and I'll snack on something and then have a late dinner.
Okay. Do you eat out a lot, like at restaurants, or is it more like homemade food? And
Mostly more homemade,
okay.
but we do go out to eat every so often.
Okay. What about how do you manage stress? Or if you were to lose a loved one, how would you manage that?
Usually talk to myself most of the time.
Okay. Is there do you kind of go golfing or anything to kind of clear your head? Is that how you manage stress,
Pretty
or
much,
is it just more talking to yourself?
I'll go leave, either just go talk to myself, tell myself to calm down, let it go.
Okay. Do you have any concerns over how you manage stress?
No, sometimes I can get over exaggerated sometimes, but other than that, not too bad.
Okay. What about violence? Have you ever been exposed to abuse, physical, mental, or violence?
No.
Okay. And then kind of similar question. What about in your environment? Do you live in a bad neighborhood where you could be exposed to crime and violence in your neighborhood?
Nope, lived in good neighborhoods my whole life.
Okay. So kind of, again, the life satisfaction. How do you feel? Do you feel like you've gotten to a stage in your life that you're happy with where you are?
Yep, I'm
in your work,
fine.
in your life?
There's some things I wish I could have maybe done different, but at the end of the day, I'm happy where I'm at.
Okay. So safety, do you wear a seatbelt when you drive?
Yes.
Do you have carbon dioxide detectors and smoke detectors in your house?
Yes, it's required.
Okay. What about guns? Do you own any guns?
Nope.
No guns. Okay. What about, we kind of talked about the crime. What about, you said you were exposed to secondhand smoke. Are you still exposed to secondhand smoke?
Once in a while, I go to my parents' house.
Okay, so they smoke. What about lead or pollution within the air?
That's not too bad. No, I don't live in the city, so.
Okay. What are your religious views? Do you go to church? Do you have any religious views?
Just believe in God, and that's about all it.
Okay. So it's nothing that would really kind of direct your health care.
No.
Okay. So now we're gonna go over kind of some symptoms and things that you've been feeling. I'm just gonna ask you a bunch of questions, and you can just say yes or no. And if you are experiencing, just elaborate. Okay. So any fever, chills, feeling really tired, or unintentional weight loss, or night sweats.
No.
None of that. Have you noticed a rash or anything in your skin? It's really dry or flaky, anything like that? No? Okay, your nails and everything look normal?
Besides bruises.
Some bruises, okay. And your hair, hair loss that's unintentional?
No, just getting gray.
All right. Do you use glasses or contacts?
No, the safety glasses.
Safety glasses.
Sunglasses.
and sunglasses. How often do you go to the eye doctor, or have you ever been?
And it's probably since high school.
Okay. What about, do you see any funny things? Are you able to see very well, or is it blurred a little bit?
You can see fine.
Okay, no issues
No
with your
issues.
vision. What about ears? Any problems hearing or anything like that?
Nope.
How often do you use Q-tips?
A lot.
Okay. Any like ringing in your ears or dizziness ever?
Nope.
Okay. What about your nose? Any draining in your nose or stuffy nose?
I get stuffy
Itchy?
nose sometimes when I wake up in the morning.
Okay. Any bloody noses?
Sometimes I get blood nose when I'm blowing out. Sometimes you get a little blood come with it.
Any like sinus pain that you're noticing with that? Any like
No.
pressure in
Maybe
your cheeks?
sometimes above the nostril, right here between my eyes.
Okay. What about your neck? Any stiffness in your neck? It's hard to move. Any pain, tenderness? Any like lumps that you've noticed or anything like that?
None of that.
Okay. So even for men, you can develop breast cancer. So these are just some questions kind of related to this. Any lumps or soreness that you've noticed kind of in that breast area?
No.
No? Okay. And no pain at the nipple line or any swelling that you're noticing?
No.
Okay. You said the cough, but anything else, like coughing up, like what we call sputum, which would be phlegm.
Sometimes I cough up like boogers out of my mouth. Yeah.
Ew. Okay. What color is that?
Pretty much like a booger color.
Like yellow,
Yellowish
green?
Yellowish
Okay.
green.
Any shortness of breath or wheezing or anything that you've
No.
noticed? All right. And do you have a history of asthma?
No.
No. Okay. Or pneumonia in the past or anything?
No.
Okay. What about like COPD or bronchitis?
No.
Okay. Cardiovascular wise, do you do you ever get any chest pain or shortness of breath or any heart problems that you're aware of? High blood pressure, heart murmurs?
No, I'm just was told I have enlarged heart or whatever that means. But no.
Okay. Have you ever gotten that further checked out before?
No.
Okay. When you exercise, are you able to tolerate it pretty well?
Yes.
No palpitations that you notice?
That's palpitation.
Like where you feel your heart beating really, really fast or you can
No.
feel it beating? Okay. Like skipping a beat? Any like swelling in your legs or anything like that?
No.
No. What about, have you ever had your cholesterol checked?
No.
Have you ever had what's called rheumatic fever ever?
No.
Any issues with going to the bathroom? How often do you have a bowel movement?
I go number 2 about 3 times a day.
3 times a day? Okay. And is it runny, like diarrhea, or is it just normal,
Just
solid
normal.
stool? Any color issues? It's
No.
brown.
All depends what I eat, I guess.
Okay. Any nausea or vomiting?
No.
Any like abdominal pain or anything like that?
No.
Do you notice when you eat certain foods that your tummy hurts and you have diarrhea?
That can maybe sometimes happen, or I get chest pains from seasoning, types of seasoning. Like
Okay.
garlic.
Like garlic can kind of cause some abdominal
Yes.
issues. Okay. You haven't noticed like any bleeding or anything when you go to the bathroom?
No.
What about when you urinate? Any trouble like going to the bathroom, starting your flow or anything like that?
No, I have no problem with that at all.
Okay. Do you go frequently?
If I'm distracted, I don't pee as much, but if I had like a beer or something or like that, I can go a lot
Okay.
in one day. But I do take a lot of vitamin C, so it cleans out my system. So
What about in the middle of the night? Do you have to get up and go to the bathroom in the middle of the night frequently?
every night I probably go bathroom.
Okay. What about any flank pain? Any issues like with the back in your lower back? Any pain back there? No? Okay. Or any discharge that you're noticing?
No.
Okay. Let's see. So next, I'm just going to ask you, when was your last prostate exam?
Yeah, not old enough for that yet.
Okay. Any issues with fertility that you're aware of?
Not that I know of.
Okay. So some sexual history. You're married.
Yes.
And you're married to a woman.
Mm-hmm.
Okay. Just want to clarify. What's your number of current and life partners? Your sexual
Just
partners.
one, my wife.
Okay. Any do you use condoms or just oral contraceptives? Anything?
No. Just have regular sex. My wife.
Okay.
We're married, so I don't use condoms. No.
Okay. Do you have any trouble with moving your arms or legs? Any stiffness? Any pain in your joints?
My shoulders, when I sleep, I have pain.
You get pain in
Reason
your
why I don't sleep the greatest.
Okay. What about any nerve pain?
I used to have tingling in my fingers going to my elbow, but that's been
Okay.
taken care of.
Are you able to move everything really well though? No problems with
Yes.
moving your arms or legs. What about when you walk? Do you stumble a little bit, or is it a normal walk?
Normal walk.
Okay. No weakness that you're noticing?
No.
Okay. Any problems with, like, have you ever had a head injury? I think you said a concussion.
Yes.
Was that in high school?
Yes.
Okay. What about loss of consciousness? Have you ever passed out?
At work, I had heat stroke.
Okay. When was that?
I was probably 6 years ago.
Okay. What about like loss of coordination where your arms and legs just really weren't working correctly? No.
Not that I know of.
Any dizziness?
Just when I had the heat stroke and by that concussion.
Numbness?
I don't know that my arm falls asleep sometimes.
Okay. Is it a specific side or is it both?
Mainly the right side.
Mainly, is it the right arm or just?
Right arm, the hand sometimes.
Okay. Any like slurred speech or anything that you've noticed?
My wife says I slur my talk all the time, but I think I speak fine.
Any seizures or tremors?
No.
Okay. Any difficulty like forming your thoughts and being able to express your thoughts?
No.
No? Okay. Any memory issues, forgetfulness?
So far not.
Any irritability or mood swings?
Only during football games, other than that, no.
Okay. Have you ever been diagnosed with like anemia or anemic that you're aware of?
I don't know if those are.
Okay, that's okay. It's like low blood count.
Not that I know of, no.
Okay. Any history of like having to have a blood transfusion?
No.
No. Okay. Any like sensitivity to like hot or cold environments?
No.
Okay. What about like excessive drinking and excessive urination?
Like water drinking? I drink a lot of water in the summer just working outside and it's hot.
In the summer, but in the winter you're kind of like a normal water drinker.
Yeah.
And then the like excessive urination, like constantly going.
I do pee a lot. Not as bad as some people, but I pee a lot.
Okay. Do you have any questions for me?
Not that I know of.
Okay, thank you.
Turned off halfway through. I was gonna say, can I have your number? Any questions for me? You're kind of hot.